Hello, I'm Dr. John Kruse, and today I'm going to be talking to you about ADHD, coronavirus, and Donald Trump, and specifically how his problems with executive functions have shaped how the coronavirus pandemic has unfolded in this country, and also going back to the talk 2 weeks ago, bringing in the notion of ADHD is a serious medical illness and can certainly lead to death and destruction if left untreated or improperly treated. So the format again is I'll be talking for about 20 minutes. If you have questions while I'm talking, you can certainly type them in. I'll be available for up to 20 minutes after the end of the session if people have questions, but if there aren't any ready right at the end, I'll probably end right at 20 minutes or so. So some of the information that I'm going to be talking about is in my book, Recognizing Adult ADHD. That's available on Amazon and other sources. And next week's topic is going to be on some of the positive aspects of ADHD. So jumping into the concept of executive functions, we were talking last week about how ADHD isn't just a list of inattentive symptoms or impulsive symptoms or hyperactive symptoms. That our current understanding is that it affects executive functions, which involve pretty much how your brain processes the information coming into it and all the information going out of it. So planning, organization, attention, focus, sustaining attention, switching of focus, time management are all involved in this concept of executive functions. So I'm going to start out with what was going on before the pandemic hit us itself. And so the list of things I'm going to be going through related to COVID, I've compiled the list, other people have compiled similar lists, and maybe most notably Rick Bright, who's the physician at the CDC who was demoted for not promoting hydroxychloroquine as a treatment for COVID, as Trump wanted the world to believe it was. So he has produced a similar list of what he perceives as to be failings of the administration in handling the COVID. And again, my claim is that a preponderance of these items are problems that were enhanced, created, or worsened by Mr. Trump's ADHD. So the first one was the elimination of the CDC's global disease outbreak budget got slashed by 80% several years before this pandemic arose, which is a large part of why the CDC and the rest of the government was so flat-footed in their response. And this elimination of this entity, how I put that in an ADD context, is the inability to plan or think ahead or observe just what's in front of you and think that's sort of what's important to the whole picture. So Trump saw this as a way I can cut the budget, I can save money, immediate savings, immediate concrete improvement for something that's way off in the distance and probably won't happen on his watch. And that's despite the fact this wasn't a disease, the infectious disease, global disease outbreak division wasn't something that was just being promoted by the individual doctors who are involved in infectious disease. I mean, numbers of environmentalists and military have all been aware that with global warming, we are going to be facing more pandemics. We're going to be facing more people are going to be crowded together in smaller spaces. Increasing temperatures make a whole host of infectious diseases more viable across bigger swaths of the globe. The Obama presidency, as they switched over to Trump, made a special point in presentation that this is something that needs to be on your radar screen. And again, it wasn't a problem now, so who has to pay attention to it? That is one of the executive function problems connected with ADHD. And it's another way of framing it is what's called temporal discounting, where future payoffs, future consequences are not weighed as heavily as what's immediately in front of someone's face. It's related to the concept of delayed gratification and the experiments with little kids with marshmallows, the kids who were told you can eat this, you can have the one marshmallow here, or if you wait for few minutes, I will give you 2 marshmallows or more. And the majority of little kids can't delay their gratification, have to jump for the one, and those kids who have ostensibly more mature brains or can wait get a bigger reward by waiting. People with ADHD have trouble waiting for that bigger reward. So second place where ADHD and Trump's executive function problems came into the picture was in early January, where we were noticing, news was reporting hundreds and then thousands of cases of this infectious respiratory disease in China, and many other countries in the world, including both those Asian countries close to it, so Singapore, South Korea, Hong Kong, and Taiwan, as well as countries in Europe, saw this as a warning sign and started planning. They started making sure they had stockpiles of protective equipment, masks, and other things. They started to make sure they had enough respirators. They developed plans for their hospitals and what to do in case something developed. They started working on developing screening tests for detecting who had the virus. We pretty much sat there, and the president dismissively said, it's a few cases, it's going to be gone, we have it under control. And again, the ADD element here is that it wasn't a problem right in front of his face, on his watch, and his ground. It was easily dismissed, and many people with ADHD, if it's not right in front of them, if the homework's due tomorrow, that's not a problem today. So again, this is it. And I'm not saying ADHD is the only reason he wanted to dismiss it or not look at it, but it's a significant part of it. So next stage is very late January, early by February 1st, Trump makes a dramatic move, which he feels he hasn't gotten enough credit for. He cut off flights from people from China coming into this country as a bold, decisive way to prevent spread of the infection. And yes, it sounds like it was a good and appropriate move. Part of why the ADD connection here is that many people with ADHD are particularly visually oriented and particularly concrete oriented. So something concrete, close the borders, shut off flights, is dramatic, it's a visual, it's in front of your face, whereas more nebulous things like developing a plan for what hospitals will do if the caseload gets to X amount, developing supply chains, so most of the masks are made in China. If that's cut off, how are we going to have masks or other supplies we need to protect citizens? So tasks that required sustained attention and sustained thinking were not on his agenda and not what he's good at. As someone with ADHD, he opted for something bold and dramatic. And even there, the inattention to details, which again is a hallmark of executive problems with ADHD, was so prominently a flawed part of his shutting off the border. So one, he shut off the border, the flights, and that was of Chinese nationals coming into this country. In the weeks and months after February 1st, there were thousands of people, most of them American citizens, who had been exposed to people with COVID in China who were allowed to fly back. So this bold, decisive move was rather inanely constructed in that it was not designed to be effective for what it was ostensibly there to do, which was to reduce the flow of anyone who possibly had virus coming into this country. Selecting out Chinese nationals can't come to our country versus American citizens who have been there associating with Chinese nationals. The virus doesn't make those distinctions. Trump made those distinctions. It was a foolish distinction to make, particularly in combination with, we did a horrible job of screening with temperature or history taking people who were flying in from China, or even more notably, we had a number of different cruise ships where we knew people were infected. And during the course of February, as people were off-boarded or temporarily held offshore, there was no organized screening. There was no organized attention to, we moved them off ships onto military bases in this country People who had symptoms reported that for days and weeks they went without even having their own temperature recorded. When we began having some testing available, many of these people weren't screened. Much of the quarantine was so lax that people who were infected were able to interact with people who were staffing the military bases or near those military bases. So rather than having a bold, decisive action where we kept the virus at bay, we actually welcomed it into this country with open arms. And again, that lack of attention to detail, that lack of organization, again, not that Trump himself is going to be taking everyone's temperature, but his own disinterest in anything that was involved in the details of getting this right was emblematic of part of how this country started failing in its response to the epidemic. Starting in late February and early March, where more and more cases became detected, and eventually we had catastrophic number of cases in New York City particularly, and Trump started having his coronavirus press briefings. So one area where his ADHD came into play there is just his sheer inattention. There were numerous times where either Anthony Fauci or Deborah Birx or other health leaders in our country gave information standing right there in front of him. He's attending at the same meeting as everyone else, and 5 or 10 minutes later, he is repeating inaccurate information that directly contradicts what he might have been hearing if he were listening or paying attention, but because of his ADHD, he wasn't paying attention. So we're not talking about philosophical differences here about opening up the country or shutting it down, which again, some of those are in place and affecting the situation. We're talking about examples where his pure inattention, so information is being presented to everyone, is not penetrating into his head, and then he's giving out information which, one, is both inaccurate, and two, is causing even more confusion besides the fact that it's inaccurate, because it's contradicting what other people are saying at the same time. As the coronavirus deepened and the president sort of jumped into this in a hyper-focused way, so he wound up spending, instead of giving discrete, focused presentations about what we know is going on, what are adequate or recommended health precautions be taking in the world, or taking in your own lives in terms of masking, social distancing, washing your hands, and giving tallies of where the cases are and what we see is headed, which many governors and many states did in a controlled, informative way. Trump got hyper-focused, and his brief press accounts became rambling monologues where he would go on and on and on and on at length. And again, at that time, he was hyper-focused, and hyper-focused, again, is a concept that makes sense, knowing that ADHD isn't just inability to focus, it's a problem with the control of focus. So people can have distractibility, or they can get so glommed onto a certain topic that it's hard to pull them away. And numerous people were telling him after several weeks of these press conferences where he was going on way too long, he was contradicting himself, he was contradicting health authorities, he was detrimental to his own cause, he was violating all the general outlines and rules that public health officials know to follow when giving the public recommendations for dealing with the pandemic. So his hyper-focus, his inability to pull back and look at what he was doing, contributed to chaos and further confusion among the public during March and April, and eventually he got enough negative feedback from people, he did stop those conferences. And again, in sort of an ADD fashion, he didn't pull back and decide, okay, I'll give you 20-minute briefings once a week as to what's going on in the country and what we've learned in terms of developing treatments or further advances in public safety measures, or what I'm doing to ensure the pipeline of ventilators is getting to the adequate places, or medical protective devices. he just cut off the briefings completely. And yes, again, people have identified there may be political motivations to pretending that the COVID virus isn't an issue and not a problem. And if we just look the other way, it won't be there. But there have been numerous reports from aides within his administration who have said he's not just, he's moved on. This is beyond him. It's not just a ideologic change of mind or conscious defocusing on this. This is out of sight, out of mind. He's moved on. And again, it underlines what I talked about last week. One of the hallmarks of ADHD is people with ADHD are interest-driven rather than importance-driven. And that concept is only understandable when you understand ADHD is an aspect of executive function disorder. So most of us, if we know something's important, like paying our taxes or moving our car because it's street cleaning day, pay attention and take care of that. But people with ADHD tend to know, oh yeah, that's important, but oh, this other flashy new thing is interesting to me. Oh, my re-election campaign's more interesting, even though your own success in your re-election campaign is dependent on a good response to the COVID virus. So a few other areas that I will focus on in terms of how ADHD has affected Trump's approach to the coronavirus is specifically during these press conferences, there were numerous times he just sort of blurted out without in-depth thinking whatever he was mulling over at the time. And the most famous or infamous example of this is when he talked about, oh, you could maybe use UV light or maybe inject disinfectants into the body to clear it of the virus. He was roundly mocked for telling people to do these things. And if you pay attention to what and how he said it, he actually was very clearly not ordering people to do things. When he orders people to do things, he tells them in 2 or 3 word sentences: lock her up, liberate Wisconsin, build the wall. So when Trump gives orders, they're short, direct sentences. When he's just meandering and sharing what's on the top of his mind, as he does so often in press conferences, again, this is a feature of ADHD, this is a feature of executive function problems. He just sort of meanders through different topics and his musings on them. And again, that's probably not inappropriate for him to be doing that at a specific briefing about coronavirus, but that's what he did. One other area that people with ADHD, an executive problem with just organization, has been rife throughout this administration, and it's emblematic in the COVID handling of the COVID pandemic. Initially, the logical point man on the administration with Health and Human Services, ASAR, was nominally leading things, and then Trump decided that Pence would be in charge of it, quote, because he was not doing anything else. ASAR wasn't even notified ahead of time about this change. And then there were several weeks where Pence was nominally in charge, but there was also a shadow committee run by Jared Kushner who was in charge, and maybe ASAR was still partially in charge, or maybe Trump himself was interceding and deciding what to do, or maybe we were letting the health officials like Anthony Fauci and Deborah Birx be in charge. But there hasn't been a clear organizational plan, and to the extent organizational glimmerings of an organization were offered, they haven't been followed coherently for anybody's benefit. And the states run by both Republican and Democratic governors have complained that the communication between the federal government and the states has been jumbled. Accessibility to testing supplies, accessibility to medical equipment, which the federal government is the only one in position to be organizing for the whole country, has been completely unorganized. So again, to sum it up, the procrastination, the disorganization, the inattention to details, the lack of planning ahead, the blurting things out, the contradicting himself, all of these are symptoms of ADHD. They all are understood in the light of executive function disorders. All of them have contributed to more people being dead in this country than we would otherwise expect if this government had had an organized, effective response to the coronavirus. And unfortunately, we are still in fairly beginning stages of this, and it is ramping up right in front of this. And there are going to be unnecessary deaths that I would attribute directly to ADHD. So I am open for questions right now. I will stick around for a minute to see if any questions. This will be posted later, so if you see this later or think of questions later, you can post them there and I can attempt to answer it. This may have sounded negative and doom and gloom and highlighting some of the problems resulting from ADHD, and to counter some of that, next week's topic again will be on some of the positive aspects of ADHD. So if you still have time in your shutdown and you want to read my book, it's called Recognizing Adult ADHD. If you don't like reading, there is a audiobook very ably narrated by my friend David Drummond. And there are also Kindle and Nook versions, so e-versions if you don't want to buy the physical book. And there's also a host of, I think, 50 plus articles now on medium.com under my name addressing Donald Trump and ADHD and how it affects him. So I'm seeing one question coming in. It says, as an adult with ADHD, how do I avoid things Trump does? So I'm not clear if the question is, how do I avoid making some of the same mistakes he's doing? Or if the question is, how do I avoid dealing with thinking about facing some of what he's doing? So I'll try to answer both quickly. One, and I'll talk about it in a later time, and I've touched on it before, very clearly there are times this president does take stimulant medication. He does not take that regularly, and I would think that he would want the president to be organized, able to respond, not overly impulsive every day on the job. So one simple answer is take your medication if it's helping you regularly, not just sporadically. Two is we know that medication is never the whole answer with ADHD. The amount of structure you set up around you, and that can be through friends and support systems, it can be through work, it can be attempts to schedule your own life, are important and can help keep you on track. One thing that Trump has done, and this is probably because of his narcissism, interferes with his ability to deal with his ADHD, he has fired pretty much anyone who attempted to put structure, organization around him, which would allow maybe his better talents to flourish. So that's a mistake not to make. In terms of limiting your own exposure, I know there's people who don't like me to be talking about Trump and ADHD itself, but in your daily life, one thing I really strongly encourage is limiting your exposure to the news. If it's that cataclysmic, if they develop a virus or a medication that cures it, it doesn't actually really matter whether you find out about that at 10 in the morning or wait till 4 p.m. at the end of the day. So I would strongly recommend for people with ADHD and everyone else, unless your job is in the news media, to only watch news once or twice a day for a discrete, specific, limited time. And I actually recommend reading is a way of obtaining your news that allows you to control the rate that it's coming into you. It also sort of allows you to completely stop and pause if you need or want to. It also engages more cerebral, thought out approaches rather than visual imagery is more closely triggering, hardwiring, bringing up strong emotional responses. So if you're watching the news feeds every minute, you are more prompted to feel like I have to respond to every good thing or every stupid thing or every scary thing that comes in each moment. So again, those are ways for you both to be less like Trump if you don't want to replicate some of his behaviors, and how to deal with a world where some of Trump's own activities are driven by his ADHD. He is driving our whole world to be more ADHD-like. So the photo comment was the person seeing some of her ADHD symptoms in the present. And again, that was actually the trigger for my book, was patients I had been working with during the last campaign, seeing behavior splash across the television screen and saying, oh my God, is that what I look like when I'm talking to people? Or am I getting off track that much? Or is this what I sound like to others? And one of my patients having the insight to say, the most important, valuable thing that Trump could do for me, and she was not a San Francisco liberal, she wasn't hating on Trump, but she said the most valuable thing he could do to me would be for him to come out as having ADHD, because that would help explain to other people in her life how pervasive a disease condition this is, and how it affects people in so many different ways, and that this isn't just being careless, this isn't just being stupid, this isn't just ignoring people around them, this isn't just being lazy. So again, ADHD is something that affects work life, school life, social life, a variety of parts of life in very serious ways. This is not just something trivial. So it looks like I don't have any more questions coming in. So again, be safe, try to be sane. I will be back next week, and I'm happy to try to address questions between now and then. That's all for now.